Hello, everyone. Thank you for joining us today for Dr. Care's webinar on 3 key strategies for a better practice. Let me start by introducing myself. Those of you that attended the last webinars or have met me along the way know who I am. But for those of you who have not, I'm Paulo Gomes, Dr. Care's founder and one of our managing directors. As many of you know, here at Dr. Care, we help primary care physicians enhance patient care, run better businesses, and improve the quality of their own lives. And to date, we've helped over 1,000 family doctors improve the lives of more than 1.5 million patients through our suite of services. Before we start with content, there's a few logistics I'd like to review with you. We are using the GoToWebinar platform for this webinar. All participants have signed on in listen-only mode, but throughout the webinar, you're welcome to submit questions through the chat console. If you have logged into your computer to see the presentation on the slide deck, you will notice that the GoToWebinar console on the top right of your webinar screen. Through the chat feature, please feel welcome to type and submit your questions. We'll try to answer your questions at the end of the webinar. All of your questions and your identity will only be seen by me. I will read out your question, but we'll keep all identities confidential. Also, this webinar is being recorded and you will be provided with a copy for review and sharing after the webinar. Today, we are going to share our tips for improving billing, efficiency, and overall patient care at your primary care practice. These tips are basically based on our work over the years with hundreds of doctors, working with hundreds of doctors throughout Ontario. We really only have 20 minutes for this webinar. So what I'm going to try to do is stay very broad in an effort to appeal to doctors in all patient enrollment models, including FOs and FIGs and FINs, and even some fee-for-service doctors. Our plan has been to host a bi-monthly series of webinars. This is the third one in our series of topics. All of our webinars are created based on feedback from our clients, as well as potential clients. So please do not hesitate to send us your comments and questions, which will really help create future content. So before I begin, I'd like to again mention that this webinar contains only 20 minutes of me chatting to you. Improving your practice is really an extremely complex topic. So I'm going to try to keep my tips here short and clear in this brief time frame. This webinar is a sneak peek introduction to some of these best practices, but for a deeper dive into the topics, look out for our upcoming comprehensive white paper, Building a Better Practice, 3 Key Strategies, that will be published in January. And this is basically a 20-page white paper that goes into a little bit more detail on all of these tips that we're going to provide for you tonight. And thanks to you for joining tonight. We're going to send you a PDF of the white paper shortly after the webinar, so you're exclusive access to it. So look for an email from me over the next couple of weeks with a link to the PDF. And again, this white paper is going to give you a lot more detail on the tips I'm going to cover tonight. So our first strategy to building a better practice is fairly straightforward and something we've really stressed here at Dr. Care in previous webinars. Make billing easier. So this sounds simple, but we all know how billing to the Ministry of Health is still a fairly laborious process that continues to get more and more complex and is prone to human error and a multitude of other issues. Also, most doctors really are not formally educated on all of the billing codes available to them and how to use them effectively. This lack of knowledge leads to billing revenue that is not optimized, inconsistencies with respect to Ministry of Health billing guidelines, and significant inefficiencies. So here's our first tip. Reduce errors by addressing manual processes and poor billing knowledge. So the first thing here is train your staff on day-to-day billing. And our A tip here is hire a reliable office manager or assistant and train them and any other staff that's doing billing on the billing. It's really important here to invest the time. Start by enrolling them in an OMA billing education session. And then if you need additional billing expertise, our Folk Care or FIG Care services at Doctor Care are an option to help support your staff. It's important to find people you trust to do the job right, freeing you up for more important work like patient care. Second tip is to organize your day to optimize billings. So create a quick guide of the codes you plan to use most often. And for you faux physicians, create a list of the out-of-basket codes that you want to use more often, but you are not able to remember them on a day-to-day basis. Resist the temptation to write out billings on a day sheet for you or your staff to enter later, because that's inefficient. Instead, schedule a few minutes after each patient visit to input billing directly into your EMR. This is especially important if you're in a capitated model like a FO or a FIN, so that you're able to maximize those out-of-basket billings, which you may otherwise forget to do. Third tip is to stay on top of updates from the Ministry of Health. Don't ignore them. The fourth tip is to get regular insights into your cumulative billing. Take a close look at your billings every month to see where you've gained and lost. Physicians often lose anywhere from 10 to 20% of their income simply by not understanding how to fix their errors or how to read their RA to identify missed opportunities. So our second tip for making billing easier is to take the time to implement better tools and processes. At Doctor Care, we do this for our doctors all the time. You need to find a process, system, or solution that breaks down the barriers in your billing workflows. You need to then build in reminders, recall schedules into your processes and EMR forms, and make it easier to remember codes in your daily workflow. And you need to put a process in place to minimize billing errors and to ensure your staff know how to fix the common ones when they do come up. By improving your workflow, easy errors get fixed quickly and efficiently, and you'll have the time and resources to investigate the more complex cases. For capitated models, your outside use report from the Ministry of Health only provides a month's worth of data at a time. So it's hard to quickly see any trends over time. But wouldn't you like to know at a glance what each patient is worth to your practice before you consider derostering them? So our third tip to make billing easier is to get more roster visibility in order to gain insights for actioning. So to get the complete picture of a patient's activity, look back at least 6 months. Use this data to pinpoint which patients should be taken off your capitation roster and seen on a fee-for-service basis because of outside use, and which high needs patients may need to be sent to other providers to get the care they need. So it can be hard to get deep insights without sacrificing time on patient care. If you don't have the time to mine the reports for data you need, find someone who does. Give the responsibility to your trained in-house billing expert, or bring in help from somebody like us at Doctor Care. Lastly, create a system for rostering new patients. We often see that the patient roster in an EMR rarely matches the roster in monthly Ministry of Health reports. So the problem here is the patients you think are rostered may not be, because your EMR does not match the Ministry of Health reports, and that means missed revenue. So we recommend to start with a cleanup of your roster records. Then with a bit of training, you and your team can spend a few minutes every month matching your Ministry of Health roster to your EMR, and problem solved. Knowing when, where, and how to maximize your bonuses from the Ministry of Health is a challenge. So our fourth tip to making billing easier is to encourage you to invest some time up front and to become educated on the bonuses, the annual bonuses, the quarterly bonuses, the monthly bonuses, and learn them in and out, as this is critical and makes a real impact on your billing revenue. Make it a priority for yourself or a trusted member of your team to invest some time into understanding how the various bonuses available to your patient enrollment model work. And specifically with respect to the access bonus, if you have a negative balance, try to make it a priority to at least get back to neutral. Simple roster management techniques, patient education, and changing around your group after hours availability all go a long way in helping you earn a portion of this extra 20% of revenue of your capitation that's available to you. When we work with doctors on these tactics, after a year, we usually see at least a 20% drop in outside use and an increase of at least $8,000 in their annual access bonus. Let's move on to our second strategy for how to build a better practice: make your office work more efficiently. So there's really many ways to make your office and your staff more efficient. I'm just going to cover 6 that may be the most impactful for your practice. Number 1, improve the physical layout of your office. Number 2, if you're in a capitated model like a FO, schedule your patients using advanced access principles. Number 3, build in efficiencies to eliminate after-hours paperwork. Number 4, reduce time-consuming in-person communications and start using phone and email with patients when appropriate. Number 5, learn to use your EMR better. And number 6, utilize your office staff for more of your daily tasks. So let's talk about improving the physical layout of your office. First, use your staff more efficiently. Give qualified staff responsibility for preliminaries, such as walking a patient to a room, checking weight and blood pressure, etc. That way, you as a doctor simply have to enter a room where a patient is already waiting and very little time is wasted. Second, ensure your office has signage to clearly direct patients. Let patients know where to check in with an easy to spot sign. And train staff to greet appropriately and handle incoming patients, as well as triage them. And third, update your office layout. Simple office space efficiencies can improve your overall service delivery. Think about how your waiting room is laid out, how your rooms are organized, and even where your receptionist's computer and printer are located. How can you make things easier for staff to do their jobs and patients to be seen most efficiently? Let's talk about appointment scheduling in capitated models like a FO. In an ideal practice, patients should be triaged so that those with urgent needs are seen same day or next day to reduce patient backlog. Remember, improving patient access is a priority for the Ministry of Health, so we recommend setting aside 5 to 10 slots daily for same-day appointments for patients with urgent issues. This will also ensure that your access bonus is optimized. Next, let's address day-to-day documentation issues. I know that daily documentation is never ending and the paperwork backlog can overtake time better spent with patients. In an ideal practice, you should be able to see patients and complete all documentation during your clinic hours and simply leave at closing time. But that's probably not your reality today. Instead, you probably log extra time filling out forms, which can impact your work-life balance and ultimately your productivity. So to eliminate that after-hours paperwork, build in efficiencies, such as setting regularly used patient forms and templates for easy access during or just after a patient consult, and figuring out ideal appointment timing. Should patients be slotted in every 15 or 20 minutes with 5 minutes in between to complete documentation? Or would another ratio work for you to better your practice? And ultimately, every practice is different, and it just takes an investment of your time to understand that. Next, let's talk about using phone and email at your practice to communicate with patients when appropriate. Not every patient request requires an in-person appointment with you. Phone and email may be just as appropriate for small and minor items. Phone calls and emails are a vital component to delivering efficient care. They reduce unnecessary visits to your office, freeing up your office hours for patients who need your attention in person. And you'll also benefit from extremely thankful patients as well. Use your EMR more effectively so that you can eliminate unnecessary manual processes, and better yet, save time. For example, think about maximizing efficiency through implementation of EMR forms, templates, billing systems, and reminders. When they're used efficiently, EMR forms pre-populate with information from the patient's chart. All you need to do is add your notes, and the form is sent to the next healthcare practitioner to address the next step in the patient's journey. For you, this eliminates incomplete consults or the need to search for patient info, which will leave you feeling exhausted after a long day. Also, ensuring patient CPPs are complete in your EMR. We all know it's time consuming to maintain CPPs, so why not give your office staff ownership of some of the work involved in updating your CPPs so that your time is better spent with patients. Just remember to ensure that they are trained to accurately update them on a regular basis. Leverage your team to help build efficiency. So as I mentioned earlier, it's important to schedule in time to rethink processes and implement updates, assure time saver in the long run. And consider hiring qualified staff to fill in process gaps. For example, a medical secretary / assistant could triage a patient to take basic medical histories, ask intake questions, guide patients to the next steps after their consult, check heart rate, blood pressure, weight, possibly even provide injections and more. So adding just one person with this skill set could improve your efficiency from anywhere from 15 to 20%. So our third and last strategy for building a better practice involves tips to provide better patient care. So there are 3 issues that are within your capabilities that we've come up with here to address that can quickly help improve patient care at your practice, and they include addressing outside use, becoming more accessible to patients, and expanding your practice to provide ancillary services. Let's start with addressing outside use first. So it's hard to know why your patients are using walk-in clinics rather than visiting your practice, and it's a pretty frustrating exercise, but there's proven ways to address this. First, you could conduct a patient satisfaction survey once or twice a year. It's quite an efficient way to gather the information in a short period of time for your patients, which will then give you insights and will then suggest some changes to your practice. Second, you could offer same-day access to your patients, as earlier mentioned, and you can do this by changing how you schedule appointments to consistently leave open slots for same-day visits. So that's going to go a long way to reducing your outside use. And the third tip is to educate your patients on why walk-in clinics are not in their best interest for comprehensive care. And you can do this simply by putting up posters in your waiting room or communicating to offenders via phone and or email. It's amazing how patients often don't realize that they're negatively affecting you when they visit walk-in clinics. So at DoctorCare, we provide several posters for our doctor clients to put up throughout their practice. And here's an example of one. So our second tip to providing better patient care is becoming more accessible to patients. This means taking a hard look at the data to see when patients need you and for how long they need you. When you take the time to calculate how long an average patient appointment takes, then you can start scheduling in patients according to this average time interval, making you a lot more efficient. So as earlier mentioned, this could mean scheduling every 15 minutes with a 2-minute break at the end of each appointment, or every 10 minutes with a 5-minute break at the end of each appointment. It really depends on your needs and as well as the needs of your patients. What isn't efficient, what is not efficient, is the doctor who schedules in shorter or longer appointments than their actual average. And this is what often leads to long wait times for patients, or downtime for you that could be used for patient care. Figuring out what works best for your practice will reduce your appointment backlog and speed up patient care, minimizing complications and additional visits. Next, let's discuss how you can expand your practice to provide ancillary services. So every practice has high needs patients and those with chronic issues, and they can require a lot of your time. Most practices simply don't have the resources to give these patients the support they need on their own. So how do you help these patients manage their health in a more independent way? The solution is one of the solutions is to help through outside resources. So we often recommend starting to connect these patients to community resources, taking a hard look at what's available to you in your community, as well as any family health team resources. Many of these, even if you're not in a family health team yourself, many of these family health teams have actually opened up their resources and their ancillary staff for doctors in their community. You could also incorporate a resource like Dr. Care's Chronic Care Service into your practice if you have the capacity to offer comprehensive chronic disease management sessions to your patients in your own office. So this will end the webinar. Let's take some questions from attendees. If you've logged into your computer to see the presentation on slide deck, you'll notice a console at the top right of your webinar screen, and there's a chat feature there. Please feel free to type and submit your questions. And your questions and identity, again, will only be seen by me. I will read out your question, but we'll keep all identities confidential. So while we wait for questions to come in, I also want to mention that this offer we provide to webinar attendees. You can get a complimentary billing analysis review from us, where we'll provide you with an analytical report of how you're doing, as well as highlight your missed revenue opportunities, whether you're in a CCM or a FIG or a FO or a FIT. Simply type in the chat window that you're interested, or you can email us directly at info@drcare.ca. So the first question is, in a FO, my group is negative. What are the reasons I should try to become positive? So the first, I'd probably say financial gain is the first reason. With your group being negative, your group is essentially forfeiting an extra 20% of their capitation that they are eligible for. So if you think about the average practice would have somewhere in the range of 15,000 to 20,000 monthly capitation. You're essentially leaving out you're forfeiting 20% of that. Another reason I'd suggest that you think about getting positive is that the Ministry of Health seems to be cracking down on negative outside use at the group level. There was a clear warning in the recent Auditor General's report that pointed a finger at groups with negative outside use because they were effectively costing the system twice as much via the walk-in clinics, as well as paying doctors capitation. And we've seen the Ministry of Health really follow that up recently with phone calls and emails to groups with negative outside use. And we definitely see this pattern continuing. And lastly, I'd probably say it's the right thing to do. I mean, I don't think capitated models work without this check and balance. And we've seen doctors who were highly negative in their outside use over the years with a little bit of help and a little bit of investment. We've seen practices all over Ontario get positive within a year. So it's very possible to get positive. We got some billing questions. Can an AAA plus a Q012 be billed for scheduled patients after 5 p.m. and on weekends? So the AAA is only weekends and holidays. So it cannot be billed during evenings. An AAA can only be billed on weekends and holidays. A Q012 can always be billed with an AAA. So you would bill an AAA with a Q012. And the Q012 will only pay on rostered patients, whereas an AAA will pay on rostered and non-rostered. If you bill a Q012 with the AAA, it will only pay on rostered patients. And the Q012 is available on evenings. So you would bill whatever code, let's say you bill an A007 on a Tuesday night at 5 p.m., you would add on the Q012 to that. Next question is, do you have any other practice scheduling workflow tips? So the first thing I'll say is that there's a few more in the white paper, and there's going to be a lot more detail in the actual white paper. So in a couple of weeks, you're going to receive a few more. The one that comes to mind right now involves forms. In polling some of our physicians and doing some of the work for the white paper, we found that forms was a topic that came up very often. Doctors were often complaining about, needing to fill out forms, and how it requires several hours. At the end of the day, after the day, they still had forms to fill out. And what we found was it's really an inefficient time to be filling out forms when the patient's actually not in front of you. So we asked around to some of our physicians that we work with that we think run really efficient and optimized practices. And what we heard back was that their feedback was that about 10 to 15% of their day involves forms, and that their recommendation is actually to book appointments dedicated to filling out forms. That it's never a best practice to fill out the form that a patient brings in at the time of their regular visit, that they always instruct patients to book a separate appointment when filling out forms. So don't try to squeeze in the form to the patient visit. So you'll obviously need your office staff to know this policy, because they'll be required to triage patients that have forms to fill out, so that they know that in advance. But it's definitely a pretty efficient tip for your practice. And when the patient's in front of you, you have all the information from the patient, and their charts available there, and you're not having to dig into the patient's chart without the patient being in front of you. Next question. I'm interested in moving to the GTA and finding a faux practice to buy. Can you help me? Yes, we work with well over 1,200 physicians across the province, and we're always helping physicians transition out of practice and retire. There is a demand for these faux spots. It seems that the demand has definitely outstripped the supply of these faux spots. So physicians generally have to pay for these, particularly if you're within the GTA. And we've seen them sold for anywhere between 3 to 5 times the monthly capitation amounts. So that's an option. You can contact us, and we can see if we have any faux spots that are currently looking, any of our faux doctors that are currently looking to transition out. But your other option is we do believe that faux will open up again soon, once there's a new PSA. So you could just wait until that happens. Do we offer services only to doctors, NPs, or PAs? So our services, Doctor Care only services the primary care sector in Ontario, so only family physicians and general practitioners. So we do not service NPs or PAs. However, we do help physicians get PAs and nurse practitioners for their practice, and we have been involved in helping many practices get trained NPs and PAs for their practice. Okay, so we've run out of time for questions. As I said earlier, if we haven't addressed your question, we'll definitely contact you directly with an answer. And on behalf of Doctor Care, thank you for joining us today for this webinar. If you have any questions or feedback, please feel free to contact me at any time. My email and phone contacts are listed on this slide, or you can connect with me directly on LinkedIn. We're really interested in helping the primary care sector, so whatever feedback you have would be greatly appreciated. Thank you so much.